everyone, if you are joining. We're just going to take one moment to get interpretation set up on our end and let people get on the call. My name is Christina Carell. I'm PAVe's Director of Educational Programs, and I'm so happy to be hosting. This is our third and final in our spring series of parent webinars for Nevada, and we're so glad to be here with Dr. Fitzgerald as an Ask the Expert session. Just waiting for our Spanish interpreter. And then if people prefer to listen in Spanish, they will be able to. So we'll just give it about 1 minute and we'll get started.
We have to have some good music for this 1 minute delay next time. Maybe for our fall series, if there's.
Oh, it looks like our Spanish interpreter is having trouble logging in. I wonder if, one moment.
But we are very happy that we already have our ASL interpreter. And hopefully we'll get through this technical difficulty and start.
I'm just going to send an invite. Make sure we get her on here so we can offer the full webinar in English and Spanish. Oh,
and actually, I was just going to say that this has been a real thrill for us. This is the third and final in our series with the Washoe County Public Health Department in Nevada. And this is the first time that just buying you time, Christina. This is the first time that we've done our presentation simultaneously in Spanish, English, and ASL. And that's been really thrilling for us. And we hope to be doing that more and more around the country.
So she's coming in as a panelist now.
Great.
Okay, can you guys hear me?
I can, hi.
Yes.
Yay, okay, perfect. Thank you guys. I'm not sure what happened with the link, but I'm here now.
Thank you.
Did we mention it's a grassroots organization? This is what, sorry. Okay, are we ready to go?
We are, so I just want to say in Spanish, si están aquí para escuchar en español, si prefieren escuchar en español, tenemos un canal de audio y puedes accesar eso con el botón en la parte de abajo de la pantalla de Zoom. Tenemos Jasmine aquí para hablar en español. Okay, so thank you. And thank you to our ASL interpreters as well. Okay, so I'm going to throw up our title slide and pass it over to one of PAVe's co-founders, Meredith Berkman.
Thank you. Yes, so I'm Meredith Berkman, and as Christina said, I'm one of the 3 co-founders of Parents Against Vaping e-cigs. We call ourselves PAVe, and I'll just repeat again what I said earlier, that we are thrilled to be in Nevada tonight in Washoe County, presenting the third and final, sadly, in our series of webinars intended for parents and anyone else who cares about the public health of our kids and this topic of youth tobacco use. So tonight we're really honored for our Ask the Expert, Youth Mental Health and Vaping, to have with us child and adolescent psychiatrist, Dr. Joshua Fitzgerald. And if we can go to the next slide, I can tell you his very impressive resume. He is an assistant professor and program director of the Child and Adolescent Psychiatry Fellowship and the acting department chair at the UNR School of Medicine Department of Psychiatry and Behavioral Sciences. He is a clinician who leads pediatric psychiatry consult liaison service, medical director of the SOAR program. I'm going to ask him to say what SOAR is in a moment, for first episode psychosis, and the president of the committee for the Nevada Psychiatric Association. So he is truly an expert. And again, it really is my honor to introduce Dr. Joshua Fitzgerald. So thank you for being here with us.
Thank you, Meredith. I'm happy to be here.
And SOAR is?
It's an acronym for our first episode psychosis program with UNR. Stands for Strategic Outreach, Access, and Resiliency.
Thank you. I'm sorry that I didn't know that in advance. And I'm sure we'll, as this is intended to be, we have questions that people ask us in advance, but we also want it to be a conversation. And as a parent myself and a full-time volunteer for PAVe, I hope that in listening to your answers, Dr. Fitzgerald, I'll be able to ask questions that that will come up naturally as a parent. And particularly, I think this is such an important topic because as we know, our country is living through what the Surgeon General himself has stated is an adolescent mental health crisis. So while this has always been a really important issue, never more so than now, and parents, all across Nevada, all across the country are struggling with these issues. So I'll give briefly, I'll just give you the backstory of Parents Against Vaping. Behind over my left shoulder in that photo is one of my co-founders, Dorian Furman. And that actually is the story of our testifying in Congress in July 2019 with our teenage sons. And that's because Parents Against Vaping, as you can see, is a national advocacy and education nonprofit powered by parent volunteers who fight the youth vaping epidemic and the predatory practices of big tobacco. We support ending the sale of all flavored tobacco products. That's all flavored e-cigarettes, all menthol, and all other flavored tobacco products. We advocate for ending those sales of all flavored tobacco. And we also educate, as we are hopefully doing well tonight. We educate parents about the dangers of youth vaping and youth tobacco use and the predatory behavior of the tobacco industry. This all started for us in April of 2018 when one of my 4 children, my one son, then 16, came home from high school and said at dinner, "Mom, Dad, I want to tell you about what he referred to as a mixed message anti-addiction talk at school that day." And he proceeded to tell us that when the teachers and administrators left the room, leaving the 9th grade alone with this supposed educator, which is common for these talks, so that the students feel they can speak freely about sensitive topics. This adult, apparently trusted adult, began to talk to the kids about juuling. Now, back in April 2018, I must say, I really did not know what a juul was. I barely had heard of an e-cigarette, but almost every kid in that room either knew what a juul was or was already juuling. And so this adult began to tell these teenagers, juul is for adults, it's not for kids, but, and he followed up every statement as my son described, but it's, quote, totally safe. And he told the kids again, it's not for, it's for adults, it's not for you, but it's, quote, 99.9% safer than combustible cigarettes. Now, my son Caleb, being a skeptic, went up to this man at the end, along with Dorian's son Philip. My son was 16, Philip was 14, and they began asking questions. And that is when this adult said he took out a juul, he showed these boys how it worked, and he called it the iPhone of vapes. And so when my son told me this story, because he understood that something didn't make sense, he felt like this was being marketed to him and his peers. I called Dorian and our third co-founder, Dina Alessi, and said, "Did you hear about this?" And within 24 hours, we learned that this was in fact a juul representative who had come into the school without the school's knowledge through this outside group. And in the days and weeks that followed, because we were so upset about this, as we did our research online when the kids are asleep, which is what parents usually do, we were really horrified and outraged both by the duplicity of this company Juul that we learned had been marketing these flavored tech chic products to our kids and everyone's kids on social media platforms where parents were not, and through the use of young looking influencers. And we were also really frightened and upset about what we understood then was the scope, the prevalence of this issue among teens in America. And it was another 9 months, in fact, before the then FDA commissioner and the then health secretary and the then Surgeon General referred to this as the youth vaping epidemic. And by then, millions of kids were regularly vaping. And so that activated us, as I said, we took our sons and we went to Washington, and anyone who would listen to us, we talked to. We decided that we would not publicly share the school incident until it was the right moment. And I don't know how or why, but instinctively, the day that after it happened, there's an email in which we say, you know, we're not going to share this with the media until it's the right time. And that would be before a congressional subcommittee. And that's just what happened. But we can go to the next slide. Long story short, can't do that, but we created, rather than join, which we might have preferred, essentially what we felt would be the Mothers Against Drunk Driving of vaping, looking at mom's demand as a grassroots model. And here we are with our education and our advocacy. But really, some of the most important things that we do is what we ourselves learned from talking to experts like Dr. Fitzgerald. So these are parent questions that have come in. And so we'll just go to it. Dr. Fitzgerald, the first question, and I'm really eager to hear the answer to this one. What is the connection between vaping of nicotine and mental health issues? Does one cause the other? How are they related?
Thank you, Meredith. So this is, as with everything else that surrounds mental health, a very kind of complicated topic when it comes to parsing out the details of whether or not nicotine actually causes mental health issues, or in reverse, mental health issues cause smoking or vaping and nicotine use. I think that part of this looks at how we can view not just nicotine use and e-cigarettes, but the evidence as a whole when it comes to addiction in relation to mental health. You know, this isn't as easy as saying, yes, vaping causes mental health issues, or vice versa, because what we have is a lot of evidence for association, meaning we know that mental health issues and vaping or using nicotine products come hand in hand. And this is with various different mental health issues. We know that a variety of mental health issues increase the risk for substance use as a whole. What comes with that is accessibility, and especially for adolescents and teenagers, and even some of our younger people than adolescents, when we're looking at middle school and even potentially some kids in elementary school,
Right.
is the things that tend to be legal tend to be more accessible. So nicotine products tend to be the most accessible that we have to this age group. We know that there's a high level of accessibility to alcohol, but nicotine being probably the most accessible, we see kids who are struggling with mental health issues turn to nicotine as a mechanism of coping, as a mechanism of attempting to feel better. And so there is a high correlation between mental health and the development of nicotine use. Now, that's not necessarily causative, because kids are already struggling. On the other hand, what we know is when they've looked at correlations between a few specific mental health disorders, so anxiety, depression, and then what we call disruptive behaviors or disruptive disorders, those where kids have more acting out behaviors, they're tending to get in trouble more, they're a little bit more irritable or aggressive, as we know that there is a high correlation with those three specifically when it comes to nicotine, and specifically electronic cigarettes or e-cigs. The one that seems to have the most evidence towards nicotine potentially playing a large contribution or causing the disorder would be with anxiety. We know that nicotine is a stimulant. The way it affects the brain and causes increased energy as a stimulant can really affect how people feel. And one of these is an outcome of anxiety. So we know that both nicotine intoxication and withdrawal can have anxiety components. However, kids that tend to develop like generalized anxiety disorder or other larger anxiety disorders probably have a predilection towards anxiety, and nicotine definitely exacerbates that or makes it much, much worse.
So can I ask you something? I mean, you said a lot of very important things, and that are resonant probably for many parents. I mean, for me personally, you know, I've had this experience with one of my children, the one who suffers the most from anxiety. And yet when we look at, when you talk about millions of kids using these products, there must be a group that is doing it because it's the old everyone else is doing it And so they get sucked in. So how do you sort of parse out if you have a child, because when we talk to parents around the country, there are many parents who say, well, my child is highly addicted. My child had ADD or learning issues. And that, not being a scientist or a researcher in any way, and knowing that there's nothing causal that you can point to, I don't believe. But if you have a child who has some, an impulse control issue, which is what ADD is, are they more susceptible to a drug, in this case, nicotine, that will reprogram, that acts on their prefrontal cortex, acts on that impulse center and reprograms it sometimes for further addiction. So that's like one question. And then the second is, when you have kids who get sort of, quote, swept up in it, who perhaps had no pre-existing conditions, that does not mean that they then suddenly, quote, have mental health issues because they're using, or does it? And I know I've thrown a lot at you, but it is a little confusing.
Yeah, so I'll start with your second question before we go into some of the specifics of impulse control disorders. When we're talking about the reasons why kids do this, that can vary. There, as you mentioned, there's definitely peer pressure. We know that part of this has to do with just the development of the adolescent brain. The areas of the brain that are not mature yet in adolescence tend to be that prefrontal cortex, as you mentioned, the areas that control for planning and decision-making and inhibition. So we already have a disbalance where teenagers tend to be more impulsive to begin with. They tend to not think through decision-making. And so we have a group of kids who, from peer pressure, for novelty-seeking reasons, it's something new, it's something different, my friends are doing this, are likely to try this, to use this without thinking through the consequences. The hard part being with these kids, these adolescents who are using for novelty-seeking or as part of the social group, we know that the teenage brain is especially susceptible to nicotine, more so than the adult brain. And so we tend to see the process of addiction develop within the first few days of using nicotine products. So these are very, very addictive products. And unfortunately, kids are at risk even if they don't think they are, or if they don't
There's
have
enormous amounts of nicotine, so they're even more addictive. And not to interrupt, the delivery system, the nicotine salt, goes more directly to the brain, which is why they become so quickly addicted. Is that correct?
That's part of it. I mean, nicotine readily gets into the brain in any form. And so it gets there, fairly quickly when we inhale through the lungs. There's a direct route to the blood through the lungs. And so we get into the brain very quickly. And part of that being, we don't know when we're addicted. So there's also, the risk of family genetics for addiction. So kids who have family genetics are more likely to be susceptible to this just in general. And being in the mental health field and, in medicine, addiction is a mental health issue. It is a psychiatric issue by itself. And so again, the addiction process is not benign. It's not harmless to the brain. So, addiction in itself causes later problems. And whether or not we're struggling beforehand doesn't mean that we're not going to struggle with other issues down the road, especially as nicotine and adolescent or teen usage of nicotine primes our brain towards the use of other substances. So even those kids that aren't having issues, it's not benign, it's not harmless to be vaping when it comes to mental health issues.
And then thank you. What about the issue of trying to quit? I mean, one of the things that we've had, and then we'll go to the next question, but you're saying so many important things that I just feel like I want to follow up so we can all understand. Trying to quit, and I know this from one of my own children, is so difficult. And one of our partners, the Truth Initiative, has talked a lot about this and created a youth-focused campaign called A Breath of Stress Air, which relates to this question, which is really poking, drawing attention, it's sort of a satire that sometimes some of these products make claims that, this will relieve stress, that vaping will relieve stress. In fact, the dopamine reward system for nicotine is such that as you begin to crash and you need more nicotine, you think you need more and more. And as you crash to feel better, you have to take more, and quitting is so incredibly painful. So how does that process, does that further complicate it? Because if you're trying to quit, you get stuck in this cycle where, you know, you feel like your head is going to explode. And that is a direct quote from one of my own children.
Yeah.
So how does that factor in?
And this is part of the problem of nicotine being the one of the most addictive substances we have, is that stopping the usage of nicotine in any form is extremely difficult. Part of this being from a couple of different aspects on how nicotine acts on the brain. It's very quick to act on the brain, so it's immediately rewarding, hence vaping decreasing stress or anxiety. There's some truth to that because of the fact that it acts so quickly on the brain. And while it's a stimulant, it gives us a sense of mental focus and calming right away, that people often claim that their anxiety is decreased, that they feel less stressed out when they're using nicotine products, especially vape products. So part of how quickly it gets to the brain and how quickly it acts on the body, immediately making us calm, reinforces the addictive nature of that. Then we have the problem of trying to get off, where there are considerable withdrawal symptoms from nicotine. And a lot of people do get in the habit of, one of the few reasons why they're continuing to use is to prevent withdrawal symptoms. Right. And so it's hard when it comes to that. This is why when it comes to most programs and comprehensive treatment plans that focus on treatment of addiction involve therapy, they involve, group programs. There's medications like nicotine replacement treatment, which are step down programs to slowly decrease the level of nicotine that we're ingesting. So there's not the immediate withdrawal effects of stopping cold turkey. And I mean, really, this is why there's so much evidence for comprehensive treatment plans, because it's not as easy as I can just put it down and walk away and not feel bad. It's very, very difficult to stop using nicotine products.
Well, so right, and we can get into a little more. This person is asking, my kid says she vapes to cope with stress. How can I help her given all that kids are going through right now? And I think the going through right now relates what we discussed, what we referenced earlier, which is we are living through, and you will know better than I, although as a mother of 4 adult and teen, young adult and teens, I think I know somewhat that we are living through an adolescent mental health crisis that, obviously kids were already under stress. This is a stressful time, and, social media, et cetera, and all of FOMO, et cetera, et cetera. And then of course, we're still in the midst of really, this pandemic and the lockdown, and it has taken a real toll, certainly on adults and absolutely on young people. So I think that's what this parent is asking. What would you say to this parent? How can she help her? What is the best way to do that? And you referenced it earlier, but maybe we can just dive in again.
I mean, this is very, very difficult. And, we're seeing a mental health crisis with the pandemic that has continued even with kids going back to school. I work with Renown Hospital on both the pediatric floors, but also in the emergency department. And the number of emergency department visits we've had for various mental health issues over the past 2 to 3 years has been, an exponential increase. It's unprecedented, the number of kids we're seeing coming in not getting mental health treatment or help that they need. I think when it comes to specifically with vaping and coping with stress is, there's a lot of different discussions we can have, and people tend to know their kids better than I do, never having met individuals. So there has to be a sense of, these type of discussions have to be tailored to how parents view their kids, what they think they're going to be receptive to. I think first is we have to have a non-judgmental conversation about what kind of things are we going through, what is stressing us out, why has it gotten to the point where, we kind of have to use a substance to cope with the amount of stress we're under. And trying to have some level of discussion. It shouldn't be punitive. We shouldn't be mad at kids for turning to something that's accessible for coping. It's how do we help with this? And we have to know what's going on. If we think that the coping has risen to a level or the stress has risen to a level that we're heavily concerned with the nicotine use and the level of coping, is the one thing would be getting an assessment, trying to find a therapist. And there can't be, an urgent demand, that you have to stop vaping tomorrow or tonight. The problem is the more we press kids, especially those that are struggling, the more likely they are to continue that behavior or push back. And so the big thing would be trying to find somebody who can help with developing coping skills to replace the reason why we have to use nicotine to cope or vaping to cope. And the big thing with that would be, we can't rush treatment. We have to find ways where kids are motivated to stop vaping. We have to work with them at their level and sometimes at their pace, even that's a little bit slower than we're comfortable with. But the reality is we need to find better, more healthy ways to cope with the stress. And that starts with, I think, just a conversation of what we're struggling with, what kind of additional help do we need to seek out.
I mean, I think that you said a lot of things that we have found in talking with parents and working with parents all over the country that are true. One is having, I mean, in some ways, this parent is very lucky that her child is telling her, first of all, that she's able to know that the child is vaping and that the child is willing, it sounds like, to have a conversation about it. And that the parent is also acknowledging that this child and her peers are going through a really difficult time. So we agree with you that having an open conversation, not saying, do you vape, but instead saying, I hear that millions of kids are vaping, all around the country. I know, in our county and in our state, what is it like at school when you go to the bathroom? Do you, what is it like when you go to a party? That must be really hard, and just begin having open conversations. And also, as you said, we also believe very strongly that, that alternatives to suspension, you don't punish children for addiction. And certainly when you look at the predatory behavior, the Juul anecdote that I shared at the beginning, I mean, this was a targeting originally, and it continues, of companies that are preying on our kids. So I think to keep all of that in mind. And also, I mean, you and I discussed earlier as we prepared for this, there's such a stigma around addiction. And I think we have to be really careful as parents to put that aside and work with our kids and find hopefully gifted and compassionate practitioners like you and your colleagues, I would assume, to help them. We should go to the next question, I think.
And I'll add one thing before I move on to this one is, what we know from treatment of addiction and all of the evidence that we have is that when we're dealing with mental health issues in addition to addiction, we can't treat one without treating the other. If we just focus on the addiction piece, we're likely to relapse, we're likely to fail at that treatment if we're not actually addressing underlying mental health issues. And that's where kind of trying to figure out what's going on, trying to figure out if we need to see somebody is going to be important, because we don't want to push and set ourselves up for failure.
But I want to ask one thing just one more time, and you said this earlier, but I want to make sure I understand clearly. Someone, let's say a teenager who is addicted to a puff bar or to a Miley Mini, as one of my children had been doing. Does that necessarily mean, if they are addicted, is the act of is addiction itself classified as a mental health issue, so that you don't need to have a pre-existing or underlying mental health issue beyond the addiction?
We don't need to, and there are people who don't have comorbid mental health issues.
But do you still consider it a mental health issue?
We do. It is in our DSM, our Diagnostic Statistical Manual for Psychiatric Disorders. It is something that when we go into a primary care provider or anybody else, and they're screening for nicotine use, alcohol use, certain patterns of use rise to the level of being classified as a nicotine use disorder. So things like we're vaping more, we're using more than we intended, we've had withdrawal symptoms, we've failed at attempting to cut down. Those type of symptoms, amongst many other, would classify us as having a nicotine use disorder.
And that would be a mental health issue.
And that would be a mental health issue.
Okay.
I think specific to that question, though, is if it's risen to the level that we're using it specifically to cope, then the needing to turn to an external substance is concerning for what is so stressful, what are we struggling with where we've had to turn to an external substance to cope. And that's where I would get worried is we've gone beyond our internal capacities, our inherent capacities to cope with whatever situation. And that's where I start to get concerned. This isn't somebody who's potentially using it for novelty's sake or as part of the group, but somebody who's using it specifically for the purpose of coping.
Right. Well, it's so highly addictive and it's so much nicotine that even if you thought you got into it because someone handed it to you, as you said, you can become addicted immediately. And then you need that nicotine to cope because you're addicted. So it's a vicious cycle. The next question is, at what age does this become a problem? And you know, you referenced earlier, lower school even. When should I start the conversation? What is your feeling about that?
So here's some of the statistics and specifically to Nevada. So when we look at these, there's some detail that goes into it. So when we're looking at kids who it says currently vaped, this means they do it every 2 years. They do a national survey and they collect data on high risk behaviors, mental health issues, addiction issues, even things like texting while driving or other behaviors that are considered dangerous. But currently vaping, where they're using that, means they vaped within the 30 days prior to the survey, and then if they've ever tried vaping. So what we know is about in high school, and this even starts in 9th grade, where the numbers are close to 1 in 2 kids have ever vaped, starting with 9th graders, and that number goes up slightly with each year. But looking at that, when we look and we drop lower than that, the surveys have shown that about a quarter of kids have at least tried vaping in their lifetime by the time they're middle school students or by the time they're towards the end of middle school. So that's 1 in 4 at the middle school age have at least tried vaping. The 12% is those who have vaped within the 30 days prior to the survey. So this goes back to some of our classic views of having the discussion about substance use and access, or people attempting to introduce this to kids. This is why a lot of the programs historically started in elementary school with warning kids about the danger of drugs, because they are being exposed, some kids in elementary school, but 1 in 4 kids in middle school. So I think, looking at that age, I don't think it's too early to think that kids in middle school are going to be exposed to this at some point. There's going to be 3/4 who've never tried it. However, the exposure is still there. Much of the exposure from these studies show that kids have been offered substances on school grounds. And so this is where there's lots of kids around together. The likelihood, and we have to expect that the likelihood is that most kids will at least know somebody or been introduced to somebody who is vaping while they're in middle school. So I think starting this conversation while kids are still in elementary school, at least warning about the dangers of this, it is not too young, because we're going to expect them to be exposed to it sometime during middle school, if not at the latest by the beginning of high school.
So would you say late elementary school? Because, some people say, well, if you do it too early, you risk glamorizing it.
I would say, late elementary school. I think part of this is also parents understanding their own kids. When is the right time to start discussing this? The hard part is we can't put it off. Again, 1 in 4 kids vaping, that means, out of a group of, 20 kids in any middle school cohort, about 5 of them will have a vaped at some point, been introduced to it. So it's likely that kids are going to run into it when they get into middle school, just looking at the numbers. And so I think having that warning before entering middle school is important. I think if kids are hanging out with older kids, we see group friends where you've had kids know each other for years. You have 4th and 5th graders who might be hanging out with junior high kids because they've known them for years.
Or with siblings, older siblings and their friends.
Older siblings is, towards the end of elementary school, I think, starting to have this discussion. And for me, it's always finding a way as a parent to have it as a non-judgmental discussion, right? Like these are the types of things that are out there. We know at some point it's likely to come up. I think one of the biggest problems we see is that kids don't know how to say no. And that's one of the biggest problems when it comes to being offered substances is especially when it comes to peer pressure, is kids don't know how to say no. They don't know how to advocate for themselves. I think that starts with having the discussion at home.
Right. And also, right. So it's as much about wanting to help the 1 out of 4 as it is empowering the 3 who are not doing it, and hopefully will never do it if they feel empowered or feel that they have enough knowledge to understand that this is not something they're going to want to get sucked into. I know one of my children reported to me that when she was in middle school, that I think she made it, maybe this was a couple of years ago, she was in 5th grade, and everyone knew that there was this 6th grade boy who kept getting caught in the bathroom, and she overheard him say to a younger child, you know, you don't want to end up like me. I hope you don't start this. And it was so heartbreaking because he was so clearly addicted, but he understood how miserable he was, that, you know, that was one of the most touching things. You know, here's this young child, you know, so young, sort of regretting this behavior that he'd already been caught up in. I think maybe we'll go to the next slide. Okay. And this one is a tough one, and we hear this all the time. My kid is addicted to nicotine and does not want to quit vaping. What can I do? That, if you don't want to quit, even if, you know, most kids don't know that they're addicted until they try to stop, right? Like, oh, I like this. I enjoy it. I can stop if I want. They don't really think about addiction. So what do you say to this parent?
You know, this is one of the most difficult situations when it comes not just to nicotine, but any addiction in general, because for people to really be successful in getting off of substances, there has to be a component of them that is ready to quit and want to quit. And part of the problem that we see with nicotine products, e-cigarettes, smoking, other forms of nicotine, is most people don't feel the negative effects on their body. You know, it's very much having like high blood pressure. We don't see or feel the negative outcomes. It's not affecting us, you know, in the moment. And this is one of those things, is unless we're having withdrawal symptoms, we don't have ready access. Most kids, most people often say, you know, unless they're feeling the negative effects from it, they don't have a reason to quit because it's not harming them. They don't feel how it's harming them. And that's part of the hard part with some kids, is as long as they have access and they're using it, they don't see the negative effects of it. There's not a drive or a reason to quit. This is compounded with the teenage thought process and how our brain is working. Teenagers are very much in thought about the here and now. Right? Things like appearance and friends become more and more important and often overtake the importance of family. And so there's a huge component about, we're not thinking towards the future. Those parts of the brain that deal with planning, we're not thinking there. So this is really a struggle. With this kind of scenario specifically, the hard part is, why are we addicted to nicotine? What is it doing for us? And what is going to be our motivation to quit? Again, I think we have to really take a non-judgmental stance, you know, start the discussion about trying to find out some facts about why we're doing this, what we're doing. And what we tend to do on the medical side is what we call motivational interviewing, where we probe a lot, where we look for reasons why somebody might want to quit. We test their readiness to find out. And we know in general that when people are in this pre-contemplative stage, I mean, they're not even considering quitting. That's a very, very hard part to, that's a hard position to be in, because they don't see any reason why they should quit. And so part of that is, you know, having that conversation, finding out what it's doing for us. Again, it could be, it's helping us cope. It makes me feel better. It increases my energy. I feel more mentally clear while I'm vaping. There could be a number of different reasons why kids are using. Would be trying to find out what the purpose of the use is. And if we think it's important enough that we need to seek treatment now, then it's trying to find a counselor, somebody who works with, you know, teenagers, who does addictions work, to try to get them engaged a little bit.
Yeah, this is, I mean, this one, I mean, first of all, we know because of the mental health, the adolescent mental health crisis, it's so hard to find people anywhere in the country who, first of all, there are so few addiction psychiatrists because there's a stigma around addiction, even within the field. And, you know, so many kids are in need of help right now. So that compounds things. And I know later on, we'll be giving some resources in Nevada and more broadly. This is particularly scary for a parent because you're right that you can't force someone to want to quit. And sadly, we hear from parents all the time whose kids are suffering the severe health consequences of vaping, but they may not really either believe it's because of the vaping. Things like, you know, they can't run a mile, which even though they spent the last 2 years as on the track team, or, you know, in some really severe instances, you know, their asthma that they had under control since they were young, you know, becomes catastrophic in certain cases, right? And we know from the science that if you have asthma, it is greatly exacerbated by the use of these products. Then there, of course, the ongoing, although not reported by CDC on a weekly basis anymore, but the ongoing EVALI, right? That's, you know, kids who end up in the hospital and, you know, intubated in some serious cases because their bodies are responding. So those are the kids who I suppose have there's evidence for them, they can connect it. But if this one is particularly painful. I mean, I hear from you, you know, this is about parents. You know, interestingly, we understand that, you know, when talking to kids about the harm to their developing brains and lungs, I remember early on, the Surgeon General had a campaign they put out. It was a vending machine. And instead of pretzels and Fritos and Doritos, each thing that the teen could buy was a brain. And it said, you can't buy a new brain. Now, I thought that was fascinating, but it was very high level. I mean, as an adult, I was riveted, but I wasn't sure. I thought that maybe that was too much for, you know, as you said, teens tend to live in the moment, even some adults do. So we actually, in response to parents, we came up with a program called Vapes or Trash that looks at the environmental impacts of these products. That seems to resonate more for young people, the climate justice issue, or, you know, looking at the harm to the environment, to animals, to the water, to the air. And then perhaps it's easier to make the connection to the harm to their personal environment. But thank you for being so candid, and it's a process. So let's look at the next question. Okay. How should I approach this if my child has a concurrent developmental or mental health condition? We sort of talked about that at the beginning. I guess, you know, we talked about the chicken or the egg issue of but what treatment should you be focusing on, the addiction first, or the underlying issue, or at the same time? And how do you do that?
The complicated thing is at the same time. And when it comes to, so specifically mental health conditions, same time may mean overlapping over a period of time. We know that treating anxiety, depression is not an overnight treatment. These are treatments that take long, even if it's medications, therapy, these aren't switches that we can turn on, off and on. Medications work slowly, therapy works slowly. So there's ways to identify needs and look at the priority. I would say the priority is both, but that's not the reality in every situation. You know, if we have kids that are severely depressed and suicidal and coming into the hospital, we might not be focusing on addiction and nicotine at that time. It's, can we start with the depression first, get them to a place where we're more stable, and then start the conversation of addiction. So it really comes down to what we think we need to prioritize from a standpoint of more urgency. If we have kids coming in where they've got, you know, moderate or mild anxiety disorders that are problematic enough where they're seeking psychiatric help and they're using nicotine, it might be, we don't know that we can treat this while we're still using nicotine. We need to have the process start with decreasing the nicotine uses, stepping down while we are treating the anxiety. because they kind of exacerbate each other. And so we can't successfully treat one without the other. So it's going to depend on the individual and the individual struggles they're having. The hard part is when it comes to developmental issues, this complicates things from a standpoint of where we are at from kind of a mental and cognitive standpoint of understanding the risks. We have to meet kids where they are. If they don't have the capability of understanding the risks, we might have to take that as a family, that more paternalistic view of setting limits surrounding it, maybe restricting access. And so if there's a peer or a friend that is using, that might mean making hard choices. But I think it depends on the understanding. And so there's problems there. If we're talking about physical developmental conditions, I think the concerns about the effects on the lungs and the medical components of if we have heart conditions or other stuff have to play a role and take more importance. So the question becomes, when we're talking about developmental conditions, are these developmental from the standpoint of intellectual disability, autism, those neurodevelopmental disorders, or are we talking about more physical health developmental issues where we might have some level of genetic disorders or lung issues or other things that play a role. And so this is where assessing each individual person is going to be important, but the reality is they're both going to be important. We have to focus on both, and we have to figure out what the priority is depending on that individual person.
Well, I wonder if we have heard this from many parents who, if their kids are very severely addicted and they send them to inpatient programs, that there are still lots of inpatient programs out there that allow kids to vape because they think, well, maybe there are kids there who are addicted to, quote, harder drugs. And so we have heard that from parents, that parents who may be sending their kids to an inpatient program in the hopes that maybe it's not the only issue, but that they can get them off nicotine, only to discover that not every program or not every practice is as tuned into the dangers and the harms of the normalization of the vaping behavior with nicotine and the harms to the nicotine itself. So I don't know if you have had that experience. Obviously that is something, you are an expert on this, but we worry about that because we've heard it multiple times.
And I've heard this from patients who have gone into addictions programs. I mean, we've heard this in adult patients who have gone to addiction treatment programs where they're allowed to continue to smoke cigarettes because withdrawing from multiple substances and attempting to stay sober from multiple substances can be very hard. And the more quote unquote dangerous drugs are the more priority focus in some of these situations.
Nicotine is a dangerous drug for these kids though, isn't it?
It is. And the hard part is I think there's a serious consideration of, is there any benefit to continuing to vape in these situations versus using nicotine replacement treatment, patches, lozenges, gum, where we can step them down while they're in treatment in a controlled environment. The hard part becomes, and it depends on why kids are going to treatment, is if they want to get off other substances but not nicotine. Again, it's one of those things, forcing somebody into sobriety may not benefit long-term success. And so this is where, using nicotine replacement treatments and therapies is vitally important towards making sure they're not withdrawing, but removing the form at which they're using during that treatment. There's a large component, there's a social component, there's environmental cues, there's the form in which they're using, which all play a role in addiction. Transitioning to other forms of nicotine replacement therapies is important.
Right. And plus there are, one of the things that we, and we've discussed this also, is that there are many companies that are now, it seems to be deliberately confusing consumers by creating flavored products that appear to be nicotine replacement therapies, but they're not. They don't have step down programs. And that we find that very troubling and very confusing for youth and even for adults who seek to help their kids. We could go to, thank you. Are changes in the adolescent brain from nicotine permanent? And can it increase the likelihood of further addiction?
So the simple answer to both is yes. Now, I think the hard part becomes when we're looking at permanent changes to the adolescent brain, there's a component that's a yes and a component that's a little bit we don't know. A lot of our evidence has come from studying animal models because it's very hard to know what's going on neurobiologically in an adolescent's brain. What we do know is from cognitive testing, we know that nicotine, its effect on the prefrontal cortex, and then the secondary effect on the dopamine reward system, that it changes those systems. Inherently, there's structural neurological changes to those systems. We see things like increases in irritability. We see focus and memory issues, attention issues. And so those tend to, at least from what the evidence looks like from cognitive testing, those tend to be permanent changes. We also know that it changes, and these two questions go hand in hand, it inherently changes our dopamine reward system. So drugs of abuse, including nicotine, artificially and exponentially increase the amount of dopamine and the activation of the reward system. So things like food and pleasure and enjoyable things are rewarding to us as humans, and they spike dopamine in our brain, and our reward system activates, and it makes those pleasurable things more likely to do. Nicotine and other drugs of abuse increase that reward initially significantly more than anything we know that has to do with food or pleasure or other things. And so what we see is we start to see a desensitization to rewarding behaviors, things that are of normal level of reward. And what that means is they become less rewarding. Only things that are affecting our brain at abnormal levels are telling the brain, this is a rewarding situation for us. And so it kind of hijacks that reward system. That tends to show long-term changes. So we see that persist into adulthood, where even when people have stopped using, they have what we look at as abnormal processing or an abnormal reward response, to where it's kind of hijacked that system and altered it. So it does become problems where both, the cognitive, the thinking, the attention, the memory issues, and the reward dysfunction that we see can persist into adulthood.
So even if you, let's say you successfully quit, you'll be, obviously different than you were. Then, I guess, from the child's perspective, well, if I'm going to be changed, why would I bother quitting if I can't go back to what I was? That's terrifying.
So the reason is, one is there's a potential that we don't go back to where our baseline was over time. There's also a question of kind of the load of nicotine that's gotten into our brain and the duration of use. So the longer we use, the more likelihood there is of permanent changes. And part of this being every individual person has a different susceptibility level. Everybody's brain responds a little bit differently. Our brains are fascinating in the fact that we can cause damage for some people and it's not necessarily noticeable. People can recover from certain levels of damage, but everybody's different. The thing we do know is that there are some permanent changes. The question is, for an individual person, is that vaping a few times? Is that vaping daily over a 5-year period or a 10-year period? And so for us, it's a big discussion about, I don't know that necessarily somebody's having memory issues or concentration issues yet, but decreasing the risk and the long-term damage. That's why we want to protect the brain and get off.
Got it. But I think we have 2 more questions. And why did my child start vaping?
A number of questions. a number of reasons, the big ones being, we see a lot of novelty seeking in kids. They want to try something new. Other people are doing it. It's cool to them or their peers. And so they're willing to try something new. Why did your kid go cliff jumping? Why does your kid want to go skydiving or do something that's new and adventurous? It's because the adolescent brain is primed for novelty seeking behaviors, things that are new, things that are going to reward it or potentially activate the brain to a level that says this was amazing. What they see with their peers doing it is their peers are telling them this is the good thing, it'll make you feel great. And so there's that novelty seeking.
They're flavored and they're accessible. Yes. As you said, that's the whole ball game. They're accessible, they're flavored, they look cool. And
their friends are doing it. And that's a big part. The other ones being peer pressure. Maybe some kids don't want to, but they don't know how to advocate for themselves. They don't know how to say no. And so they're likely to do it from a peer pressure. They want to fit into the group. And then one of the last big reasons is we're struggling with anxiety, we're struggling with depression. We have a neurodevelopmental disorder like ADHD where our brain is primed to be more impulsive, try things that maybe are riskier, and mental health plays a role. We know that mental health in general, across a variety of different types of disorders, prime us for substance use as a mechanism of coping. And when we have kids who are struggling with anxiety and depression or other mental health issues, and somebody tells them, this made me feel better, this made me feel calmer, this gave me more energy, it helped me focus when I couldn't concentrate, I was super tired, and they're telling somebody that it works, we're more likely to try it because our friends have said, our peers have said, this helped me, it's going to help you. Right. This made me feel a certain way, it's going to help you as well. And
versus your mom saying, don't try that. Right. Right. Well, and I'll just go through this very quickly because I think this is really important. I mean, parents always say, what are the signs? Secretive attitude, closed door, frequent excuses to use the restroom or go outside, a sweet smell, the use of candles or room freshener to disguise the smell. When my son had asked for a diffuser, I thought, oh, he's so spiritual, haha. Dry mucous membranes from the propylene glycol in the nose, the throat, the mouth, drinking more fluids, craving salt or spice, nosebleeds, mouth sores. You start finding these unusual items like the colorful plastic caps, the USB drives, small highlighters or pens. These are stealth by design. Let's just go to the changes in sleeping patterns, raspy cough, lung infections, chest pain, shortness of breath, pneumonia, heightened sensitivity to caffeine, jitteriness, anxiety, irritability, mood swings, anger. You talked about those. Changes in eating habits. There are some studies that show that kids who vape, or there's a link between vaping and eating disorders. I've seen some of that research. Nausea, gastrointestinal issues, extreme weight loss. They call it Nick sick. And unknown or increased spending or deliveries. Now, if you see one or two of these, maybe your child really has to go to the bathroom, or maybe they're just jittery because they're a teenager. But these are things, certainly if you see them in coordination, or I think really if you see a change in behavior and any of these are resonant, then it's something you want to think about. And we can go to, I think this is maybe the last slide. Or as a psychiatrist, what concerns you the most about youth vaping?
What concerns me the most, this is a complicated situation because it's not as simple as one very straightforward answer.
Sorry.
No, I mean, it's a big discussion, and it's, you know, the number of things we've talked about today plays a role in it. I think this goes hand in hand with some of our other substances of abuse. The acceptability and societal acceptance of this. You know, these things are everywhere, meaning, you know, kids can get their hands on them. They are extremely accessible to teenagers. It's become
the social norm for this generation.
And and it's acceptable in society. People have been led to believe this is a safer option. It's not harmful. It's not going to hurt you. And that has been bought into. So it's out there, and most
proven incorrect. Well,
and most of the teenagers we talk to believe it's not harmful. The problem is, that is to me the biggest problem, because all of the negative effects of that comes from the standpoint of we have access and we believe it's not harmful. and it's societal, it's acceptable within society and within their peer groups. And that's one of the most concerning things, because the number of youth we see coming in for mental health disorders, for other types of treatment, and there's no concern from families as far as the use of vaping products or nicotine products. A lot of the families don't see it as harmful. And so that's the problem, is we've seen this come in this direction. What backs onto this is we saw this great push in society about the anti-smoking campaigns with cigarettes. Is we saw with tracking the numbers, the evidence coming in the 90s, that we started to see this huge fall off of cigarette smoking, this target towards not having youth smoke, of decreasing access to it, of the anti-smoking campaigns. That looked like, from the numbers, those type of things, there was a strong correlation with those type of pushes were working. The numbers have trailed off since the 90s and decreased to all-time lows. And then e-cigarettes came in, and all of a sudden we're seeing this rise in e-cigarette usage, and federal regulations, anti-smoking pushes, the entire platform for decreasing nicotine accessibility has started to turn back in the opposite direction.
The lack of federal regulations, I would say. I have to say that is very well said, that the change in social norm, and as you correctly said, the youth smoking rates were the lowest they ever were. And now, this was an entire generation of young people who would not otherwise have been initiated into tobacco use, but for these products, starting with Juul and those that followed. This is really important. So we'll just put this up there and we can share it later, which is resources. And these come, the local ones especially, come from Dr. Fitzgerald, Attracting Addiction Nevada, attractingaddictionnv.com, the Carson City Health and Human Services, gethealthycarsoncity.org, healthychildren.org, the American Academy of Pediatrics, nvmylifemyquit.org, parentsagainst-vaping.org. We have resources on our homepage in both Spanish, in Espanol, and in English, in Inglés. So, I'll just, because in the interest of time and Dr. Fitzgerald's time, we're a little bit over. I just want to thank Dr. Fitzgerald so much for this really important and interesting and candid and resourceful conversation about the addiction. And I'll just say, as a final thing, I hope that everyone listening will spread the word and will be able to join us for our Clear the Vapor conference, which is May 24th and 25th. That's this Tuesday, coming Tuesday and Wednesday. It is free and virtual. It is intended for parents, for educators, for practitioners, prevention, anyone who cares about kids. And it's free by design so that everyone, wherever they live, can join and learn more and hear from experts like Dr. Fitzgerald, who are very passionate about protecting our kids. And I hope that you also, the last QR code, if you'll join us with PAVe, we're volunteer powered, volunteer run, and we genuinely care about educating parents about the dangers of these issues, and then partnering with really remarkable experts like Dr. Fitzgerald so that we as parents can hear what we can do to protect our kids. So thank you again, Dr. Fitzgerald. I want to thank Lisa Sheretz of the Washoe County Public Health Department in Nevada for giving us the opportunity for this spring series. And please join us for the conference. Dr. Fitzgerald, I hope that we'll be able to work together again to educate parents both in Nevada and across the country. You have a lot of important information, and we really appreciate your time. And thank you also to our wonderful interpreters. I know I talk very quickly. I apologize, but I hope that everyone, who joined feels that they got something important out of tonight. So thank you very much, and we'll hope to see you all again soon.